This topic is regarding Thenar space. It is a triangular space located under the lateral half of hollow of the palm. We can see here in the diagram, this is known as the Thenar space, while this is also known as the Thenar space. Let's know the boundaries of the Thenar space. We have anterior, posterior, medial and the lateral boundaries. So anterior boundary is found by the lateral part of the palmar aponeurosis, digital nerves and the vessels of lateral 1.5 digits, radial bursa including flexor pollicis longus, flexor tendon of index finger, that is flexor digitorum superficialis, and flexor digitorum profundus, that is the first tendon of superficialis and the profundus. Along with the profundus we have the first lumbricals muscles also, which is forming the anterior boundary of thenar space. Same how posteriorly, can you see here, this is known as the erector pollicis and the fascia which is covering the erector pollicis. So the fascia as well as the erector pollicis muscles is forming the posterior boundary of thenar space. Same how medially, this red color line is indicating that it is a intermediate palmar septum which arises from the palmar aponeurosis and attached to the third metacarpal bone, and it is forming the medial boundary of thenar space. Same how this green color line is indicating that it is known as lateral palmar septum, which extends from the lateral edge of palmar aponeurosis to the first metacarpal bone, and this lateral palmar septum is also separating the thenar space from the thenar eminence muscles. Now this S is indicating that is flexor digitorum superficialis, P is known as flexor digitorum profundus, and along with the profundus we have the first lumbricals, and this green color tendon is indicating it is known as flexor pollicis longus. Let's know the clinical correlation related with the thenar space. So there can be infection of the thenar space. The infection may reach the thenar space from the infected radial bursa or the synovial sheath of the index finger. Now the pus from the thenar space is drained by the incision on the first web space, that is web space of the thumb. And you can see here in the diagram, this A, B, C, D, E, F indicates the different incision which is shown on the wrist as well as in the hand. So we are dealing with the thenar space. That's why can you see here this A is indicating the incision near the web space near the thumb.